touch upon is the vaccines. Vaccines play a very important role, and I should say played, and still can play an important role, but we've gone over too far because of what we have to deal with the body in these days, with all the intake of all these antigen, all these pollen, all this, and we'll go over why we have all this pollen today. But, you know, all this pollen, all these attacks, you know, has to be regulated. And what happened with the baby is, when we were 5 years old, we used to have chickenpox. And that was okay. We had a little scratch, you know, we stayed home. We're happy to stay home for a few days. And then we run around in school showing us scabs and things like that. And we stay home, and our mother stays home. All right? They listen to this. Our mother stayed home, or if she didn't stay home, she was in contact with us enough. All right? So the mother will get the immunity against the chickenpox. So she will be immunized in case she didn't have it when she was herself a baby or a 5-year-old. So now what has happened? We want to immunize everybody for chickenpox. So now we have adults having resurgence because they're not in contact with these children. And now they're vulnerable to the chickenpox that they have in the body that is resurging. It's not a new infection, it's an old infection that is resurging from the chickenpox, which is called shingles. That's why we have a high expression of shingles today. Okay? So the key thing, and shingle is very important because if it happens in an adult also, it shows a very depressed system. So any of my patients who have shingle have to be checked for cancer. So we do colonoscopy, we do a good exam, rectal exam, breast exam, pelvic exam. We check all the area that we can check without being too invasive, you know. And because to have shingle as an adult shows a breakdown in the immune system, okay, for this early infection that should have been checked out by the thymus to research now. That means there's a very, very resurgence of that, and the immune system is weak. And then, of course, there is the acquired with the vaccine. Okay, vaccine at their place, but I stand with vaccine that vaccination is overdone, and vaccination can end up also in depressed immune system. Hepatitis, you know, hepatitis can definitely be acquired with a fragile immune system. You know, so vaccines, you know, have things in them too. All right, they have bacteria that imprint in your immune system. And sometimes they can help, and sometimes they can create problems. A lot of women in their 40s are being found to have autoimmune disease because of the vaccine they receive at a younger age. So you have to be very scrupulous. Don't just take your child to any pediatrician and get them all the vaccine that they recommend. I mean, think about it. Some of them are necessary to see if you have had an infection and to protect you. But look at the Gardasil with the young girls. And the cervical cancers. It's not even guaranteed that it's going to do anything. So now you're giving a drug that has potent complications. We've seen them. Sloughing of the skin, paralyzed. You know, so you don't want to. And the more we are in the infections or around viruses and bacteria, the more immune system rise. And that is what we're going to talk about, the sublingual immunotherapy, to help the one that really need it. All right, pancreas is important. Okay. The pancreas, I can't tell you how important it is. You know, you can see that Mr. King has some challenge at 10. Pancreas is great at 10. So something happened. Something happened that just didn't start last month or last year. A few years ago. Okay. Slowly started to inflame the pancreas. And then all of a sudden, it could have been a little viral infection, a little stress, taking an exam, but I don't think Jabari is stressed with that. I need to tell you that he is a top A student, and he is a mathematician and a scientist. You know, so the pancreas has to be regarded very, very importantly. It has 4 major functions. The pancreas, as we know, as you probably heard of, only regulate the blood sugars. It's not true. The pancreas is critical in detoxifying from heavy metals, plastic, pesticides. The pancreas is critical in regulating Also the other hormone, the glucagon, if you have hypoglycemia, not just the high glycemia, but the low sugars that precede diabetes. And people say, oh, we have a problem with regulating my sugar. The pancreas is starting to get inflamed. So the pancreas is critical to regulate the blood sugars as well. You know, as we see, can give you lots of symptoms. People who are diabetic don't have to be diabetic. Don't call it your diabetes. We can get rid of it, okay? So the pancreas is very, very, very important, and it contributes to autoimmune form of diabetes, because what happened, the gluten embed itself in the pancreas and create an autoimmune disease of the pancreas, inflammation. And it's just like the gluten embed itself in the villi and create celiac disease. So everything can be explained if we look for it deep enough. There's so much to go through. Okay. We're going to move on to the allergies. Now that you have, anybody has any question on the immune system? Everybody is clear? Yes, ma'am.